up your patient's labs this morning and the potassium is seriously low, are you panicking or are you thinking? My name's Leah. I've been an ICU nurse for 19 years, and today we're going to talk about some pause and think labs. We're specifically going to talk about potassium. When I open up a low potassium, one of the first things that I think about is this patient having any arrhythmias? Am I seeing lots of PVCs? Am I having ectopy? Is there something going on the monitor that correlates with this lab? The reason I do that is if the patient doesn't already have an electrolyte sliding scale, whenever I let the provider know that the potassium is low, I need to let them know that the patient's having ectopy with the potassium level where it's at. The next thing I look at is the magnesium level. Often when the potassium drops, the magnesium level drops. Magnesium isn't automatically ordered on a BMP, so if a magnesium wasn't ordered, then whenever I speak to the provider about the low potassium, I'm going to ask, should I add a mag on to the lab that was drawn this morning? We know that low mag is associated with torsades, and we don't want those kind of problems in ICU. So when I see that low potassium, I think, should I be given replacement? Do I already have orders for replacement? Is there a reason not to give replacement? Like, is something going on with the creatinine that's new that I need to speak with a provider about? But overall, I'm asking myself, should I be replacing this? And most of the time, the answer is yes. And the last thing I think about is, are there medicines that are contributing to this? So is the patient on diuretics? Is the patient in DKA? Do I think this is from GI loss? Does this patient have some level of renal failure? If so, is that new? And can I give the replacement that's been ordered safely, or do I need to talk to the provider about it and see if we need to do something else? If you're new to ICU and you want some help thinking through morning labs, I have a course designed for this. It's for nurses that are new to ICU. It's linked in my bio. I would love for you to join me there. There's a shared space there where you can also, on a message board, interact with me and the other nurses that are going through this course if you feel like you just need a little bit more support and you're new to ICU.